right, tonight here on ABC2, we're talking about breast cancer, and we want you to talk about it too. You can give us a call and get your questions answered. The number is 410-481-2222. So next door in Studio B, we got experts taking your call from MedStar Health Cancer Network, and joining me is an expert right here with us, Dr. Judy Grant, a radiologist from MedStar Good Samaritan Hospital. Doctor?
Hi.
Thanks for coming back. Okay, let's talk about mammograms. Who should get one?
Women should start getting mammograms at age 40 if they are at average risk for breast cancer and are asymptomatic. In other words, they have no symptoms. They should also have a negative clinical breast examination.
And what about family history? Now, what role does that play in it?
Family history. Patients who have an increased risk for breast cancer, including women who have tested positive for the BRCA gene mutation, women with known breast cancer or ovarian cancer, they should have a mammogram starting earlier than age 40, sometimes as early as age 25. And also women with 20% risk of breast cancer or greater should have a mammogram prior to age 40. That's where heredity may come into play, because there are certain risk assessment tools and there are criteria that have to be satisfied for that 20%, and heredity is included in some of the criteria there.
Well, I know what you're going to say, but sell this to the audience. How effective are mammograms? This is your life.
Mammograms are effective. The goal is to detect cancer, breast cancer, early while it can be treated more effectively. And mammography is the only imaging modality that has been proven to decrease the rate of dying from breast cancer.
So what's the difference between a diagnostic mammogram and a screening mammogram?
A screening mammogram is an x-ray of the breast in women who have no symptoms, who have a negative breast examination by their health care provider, and it does not require that the radiologist be on site when the mammogram is taken, although a radiologist eventually reads the mammogram. A diagnostic mammogram, on the other hand, is designed for women who have symptoms, or perhaps their doctor sees an abnormality, feels an abnormality, or detects some other type of abnormality, such as skin changes. Or it could also be taken in the case of patients who have an abnormality on a screening mammogram, or for follow-up of findings that were seen on previous mammograms that are probably benign and did not require a biopsy.
Okay, we know that mammograms save lives. You heard it from Dr. Grant here, I'm telling you. Got questions? Get your questions answered by giving our experts a call. The number to call is 410-481-2222. You got about 15 minutes. Chris?
A lot of good